from Ohio's Channel 4 News. Serving Ohio for more than a decade, this is Ohio This Morning from ONN.
It's a procedure that millions of Americans go through each year, and it's one that can be prevented. Find out how you can avoid a root canal next on ONN, Ohio's Channel. In today's Health Journal, the month of April is Root Canal Awareness Month. The Columbia University College of Dental Medicine estimates that 24 million teeth undergo a root canal in the United States each year, which is an incredible statistic. But one way to avoid the need for a root canal is just by maintaining regular preventative care. And who better to remind us about that than expert Dr. Gregory Janikian, a Columbus Cosmetic Dentist, who joins me now. Thanks for coming in, Dr. Janikian.
Thank you for having me.
Let's talk about this, because I was just at the dentist yesterday, but they said, too, a big misconception about root canals is that it hurts and it's painful and it's just unbearable.
Well, a root canal itself, the procedure, it should feel just like a regular filling. Typically, it's the infection that you have before the root canal that hurts so bad. It's kind of like saying, boy, the cast hurts my broken arm. Well, the broken bone's what hurts. The cast makes it better. So having a root canal should be pretty much painless nowadays.
Okay, so let's talk about exactly what a root canal is. We have some pictures. We have an x-ray is really the best way to tell. You can't tell from looking at a tooth, but talk a little bit about this x-ray and what we see in the before.
So you can see in the before the circles around the tooth in question, and the tooth's had some treatment done. It's had a crown, and there's a little dark spot on the root itself, on the front part of the root. And that's what we look for when we take films, is we're looking for breakdown in the bone. And that's why it's important to go and have films taken so we can see those things. A lot of times when we see that, we recognize there is an issue, and we go down through the top of the tooth and we fill a different part of the tooth. It's just like a filling. We just fill a different part of the tooth. We clean out any bad stuff, any bacteria. We use little baby bottle brushes to clean out the middle of the tooth. We sterilize it, and then we actually put a sterile filling inside the tooth so the body says, oh, everything's okay now, and you get to keep your tooth.
Okay, let's take a look at the after picture of what that person's x-ray looks like, and you can see what you've filled in there, which what is that filling in there made of?
The material in there is typically something called gutta percha, which is a specialized type of material that will deform and fill in any little nooks and crannies inside your tooth.
So it just kind of molds to the tooth. And we have a nice picture too, just comparing one particular tooth with the before and the after, and you can really see that what is filled in there, and it really fills it nicely.
So do you see, if you see the white in the after shot, you can really see, you know, traveling down the roots, that's the material we use to seal up the root canal space itself.
Okay, and again, it should not be a painful process. Recovery from a root canal, not much.
Most patients are very comfortable. Sometimes using antibiotics really helps, and anti-inflammatory drugs really make a difference too.
Okay, and they will notice a difference after that infection is gone, what they're going to feel like, be able to eat like, right?
Yep, exactly. It makes the tooth a lot more comfortable, and it should function just like a normal tooth afterwards.
Okay, it is a very interesting topic, and it's a great time to talk about it during Awareness Month. Thank you so much, Dr. Gregory Janikian, coming in to talk about Root Canal Awareness Month. Now, if you'd like more information, all you have to do is log on to onntv.com, click on Health, and we'll give you a link to Dr. Janikian's website.